you have a passion for the community setting. You've seen a lot of innovation
Yes.
in this place. For our listeners, typically you think about cancer, you think about your academic, centers. This is where there's often a university affiliated with it, and it's typically you have these, smaller accounts community, and there's kind of this debate, and there's this feeling that sometimes those in the community setting don't get the enough attention or the specialty care. You've seen the innovation, you've led it, you've had a passion in this. And in fact, I think I heard you speak one time, you told a story about the country singer, Minnie Pearl, and the impact. And maybe you can just take us back to the evolution.
I know where this story's going.
Of community oncology and the innovation there.
So I am a champion of community oncology. Let's face it, 80 to 85% of all cancer care occurs in the community, not in academic centers. So I've always been a champion for that. In fact, at one point I tried to get rid of the name community oncology when I was in leadership positions in ASCO.
Wow.
Because I don't think there's a difference. I think that you choose what setting you're working in.
Yes.
But it's not a hierarchical decision. It's just what kind of location and practice setting I choose.
Mm-hmm.
And I don't think it's that this one's better than this one at all. And so when I was at the University of Michigan, my love was actually for lung cancer, which when I was there was considered an untreatable disease. And I was lucky enough to have the most magnificent mentor, a guy named Ron Natale, and probably to this day still has the best bedside manner of any doctor I've ever worked with.
Really?
And I learned so much from him.
What did he do that stood out? When you say he
had
the best.
this uncanny ability to take a very complex problem, break it down into just a small amount of what's most important, and then tell that story in a language that the patient could understand. And he did it effortlessly.
Wow.
And he could do that in tumor boards, he could do it anything, just take this and always ask the right question. And he could feel it, you could tell, and he cared. I can't say enough good things about him.
Yes.
And so I was told that was career ending, to want to be a lung cancer researcher.
Really?
Because it was, if you went to ASCO at those days, which is our biggest meeting of the year, 40,000 doctors converge on Chicago every June. And the big rooms would always be breast cancer, lymphoma. And I was told, we're going to move you into one of those diseases. I said, no, I'm a lung guy. I want to do lung cancer. And they kept saying, well, you'll fail. And I heard that enough that I finally just said, well, ma'am, I'm just going to go out and work in the community. Yes. And I took a job in Cincinnati. But I also was a clinical researcher, and I really loved clinical trials. And when I got to Cincinnati, I had more patients than you ever had in your 1 or 2 days a week clinics. I had 5 days of clinic.
Wow.
I had no trials. And in Cincinnati, the only thing that was going on was NSABP. There were no clinical trial mechanisms that we could be part of. There were no large group trials or anything that was done in the community.
Wow.
So I called up friends and said, look, I don't need tenure, I don't need a paper, I want your trial. And we started opening up trials in Cincinnati.
Do you remember some of your first ones?
Oh yeah, we first joined NSABP.
Okay.
And I didn't really know what that meant other than it was a cooperative group. I didn't understand the business of trials.
Yes.
And so the only way I could keep the business running was to accrue more and more patients. Within 4 or 5 years, we were ranked 7th in the world in NSABP in Cincinnati at OHC.
How did you get such high rankings?
We just accrued so many patients. There was a need. We filled this gap that was there. And the wheels came off the bus because we didn't have a cancer center grant. We didn't have money for the infrastructure. And so I needed a research partner. And there weren't a lot of community-based researchers out there. And I talked to Lee Schwartzberger at the West Clinic, now with Oncology, and he was doing it. And we talked to him. MD Anderson was trying to put together a community, cooperative. They failed at it, but they were trying, and we talked to them. I talked to folks out on the West Coast, and then I met these 2 doctors in Nashville, a guy named Tony Greco and John Hainsworth. And literally in the basement of John Hainsworth's house, sitting down, we did a handshake deal to join what then was being called the Mini Pearl Network.
The Mini Pearl Network.
So Mini Pearl, for all the youngsters who are watching this,
yeah.
and I'm even too young for Mini Pearl, but there was a show
My
called...
grandmother liked it. My grandmother watched it.
There was a show called Hee Haw.
Yes.
And it was a variety show that was on, national TV. And their star was Minnie Pearl. She had the hat with the little for sale sign
Country
or whatever
singer.
was on the price tag. And she was second only to Lucille Ball in that era of comedians.
Yes.
And she also was a very savvy businesswoman. She owned part of the Grand Ole Opry and was involved in the recording
She's a
studios
legend.
in Nashville.
My grandmother loved her. Minnie Pearl.
And she lived in Franklin, Tennessee, which is about 45 minutes south of Nashville.
Beautiful area.
And she hated driving into
Vanderbilt? Vanderbilt, yeah.
Yeah, to get her care. Why can't she just do it close to home?
Makes sense.
It doesn't make, she couldn't wrap her head around that. And
Yeah.
if she wanted to be part of trials, she had to drive into Vanderbilt, and she couldn't wrap her head around that. She basically, when she died, she had metastatic breast cancer. She gave money to these two doctors to build a community-based network. And that was the start of the Mini Pearl Network. And we were one of the original people in the Mini Pearl Network. They later changed their name to honor her to Sarah Cannon.
Sarah Cannon.
And everybody in oncology knows what Sarah Cannon is. It's the largest community-based research organization in the world. It is the largest phase 1 network in the world. They did a joint venture in 2023 or 24 with the U.S. Oncology Network, turning it into the largest community-based research network. And we were part of that birth. I mean, so
That's
big
a
fan of community
fascinating story.
research.